You're listening to Rise Above, a Rogers Behavioral Health podcast, where we sit down with Rogers experts who are changing the way the world views mental health and addiction. Hello, listener, and welcome to another episode of Rise Above, a podcast from Rogers Behavioral Health. And on this episode, I wanted to talk about Rogers Behavioral Health. We've never really discussed the roots of this organization, how it was started in Oconomowoc, Wisconsin over 100 years ago, to becoming currently one of the nation's largest independent behavioral health systems. We'll talk a little bit about the past, we're going to talk about the future, the cutting-edge research, the AI-powered screening tools, the strategic partnerships, and how Rogers is building a future where mental health care is more personalized, more accessible, and more effective than ever. It's a somewhat broad topic, and with me today is Brian Kay, Chief Strategy Officer at Rogers Behavioral Health. I know he could talk about all of this stuff for a really long time, but he's going to make it short. Brian, welcome, and thank you so much for joining me.
Hey, Andy, thanks for having me on, and super excited to share a little bit of the history of Rogers and where we're going with it.
Well, I was going to say, we're going to talk about the future of Rogers, but let's start with a little bit of the history.
Yeah, the history of Rogers is it's incredible. We're not a newer organization. We've got close to 118-year history. And the history is kind of mired by transformation that goes over the years. So Dr. Rogers was actually an immigrant over from the UK before it was the UK in the early 1900s, late 1800s. And he came to actually the Tennessee area at a very young age. His parents passed away, and one of his aunts and uncles actually adopted him, taking him under his wing in the Chicagoland area. He went to Rush Medical School. And then if you're familiar with the Dewey Center in Wauwatosa, that was actually one of his great mentors that brought him up into Wisconsin. So in the early 1900s, Oconomowoc was kind of an incredible area that it was really known for the lakes and the springs out in Waukesha. So there was this healing aspect to it. And Dr. Rogers believed that psychiatric care involved a very big component of healing. So he had the opportunity of actually acquiring an old timber baron house in 1906, and he founded the Oconomowoc Health Resort. So him and his wife, Teresa Rogers, got it together. Teresa acted as the business side of it. So she was the one that was a lot of the brains behind the operation, getting all the models together, and he provided the psychiatric care. So they admitted their first patients in 1906. And then in January of 1907, there was reportedly a fire in one of the boilers, and the building burnt all the way to the ground. With some of the records that we have, that if you're familiar with St. John's Academy out in Delafield, the cadets and the students literally took buckets of water to try to put it out, but the building was not salvageable at the time. So, Dr. Rogers was a persistent man, and he had many people and friends around the community. And the story goes that he built one of the first brick buildings in Waukesha County. So they wanted this building to stand the test of time, and they believed in the mission of Rogers. So they rebuilt it, and that building still stands today. We are literally still providing patient care that comes out of the original 1908 building, which is just amazing. And then throughout the years, Rogers changed. So in the 1930s, his wife passed away, Teresa, and he renamed the hospital as Rogers Memorial Sanitarium. So in honor of Teresa, he wanted to rename it, and he built pretty extensive gardens. She was an avid horticulturalist, and some of the gardens and plants that she planted in the 30s still stand today. So they are still coming up. So her legacy still lives in that way. And then Dr. Rogers actually passed away in the late 1930s, and one of his psychiatrists, Dr. James Hassel, became the CEO of the hospital in the late 30s and then throughout the 40s. It's kind of interesting. I have some of our old board meeting notes from the 1930s and the 1940s, and it's amazing some of the stuff that they collected. You know, today Rogers is very much known for measurement-based care, collecting data, and you see that within the notes from the 30s and 40s. They literally say how many patients improved, how many patients stayed neutral. A really fun one was how many they in 1942 they were very proud of starting a hair salon, so they tracked the number of hair treatments, the number of nail treatments, and they reported it out in those board meetings.
They're keeping track of haircuts.
They were literally keeping track of haircuts. And
now, I know Rogers takes good notes, but that's a lot.
Yeah, it's incredible when you start digging through the history, everything that's there. And, you know, the other striking piece is, you know, it's been a staple in Wisconsin for, you know, many, many years. When you look at our members of the corporation, so the people who invested into the hospital and believed in the mission, it's amazing the names that you see on it. So, you know, we have the Paps family who's been involved. We have Mitchell Mackey for General Mitchell Airport. You've got Lucille Briggs and Stratton. You have Edmund Fitzgerald, not the song, but the actual man who was involved in it. And Henry Kohler as well, too, has found that name on our board meeting. So, you know, it's unbelievable how the history has just spread over the years. And then throughout the years, it's just constantly transformed itself to be a place of healing. And, you know, one thing that strikes me the most about it, Dr. Rogers, in some of his notebooks that we have, he believed in what is proven evidence at the time. He said, I do not ascribe to one particular school. I ascribe to what is proven to be the best treatments. And I think, you know, as we look to where Rogers is going, I'm proud to say that legacy is being carried on. You know, we take the philosophy of what is the evidence showing us and how are we providing that care.
So I was going to ask you, like, how the approach to mental health treatment has changed over the time at Rogers, but it sounds to me like it's constantly changing, isn't it?
You know, that's when we look at the history side of things, it was constantly changing. I mean, for 80 years, you know, the field of psychiatry was learning more things. And what we could see is he absolutely integrated those different pieces into the care and treatment if the research and the evidence was there. And, you know, I think as we are going today, that's one of the unique things with Rogers is all of our treatment is evidence-based. We're looking at what is out there, what is scientifically proven to get our patients better quicker. And I think the investment into our research center actually has been a great testament to that. So as we started that up in 2020, in the ability to analyze our data, publish our data, and do active research studies, we're constantly learning of what is working in our treatments, what is working in the field, and how are we getting the best possible care for people out there.
So you just mentioned a second building. It started as one building. How many buildings are there now? I mean,
oh man, so
is that a hard question?
It's a little bit of a hard question. I mean, so if you look at the locations that Rogers has, we have 23 locations across the United States. When you look at buildings on our Oconomowoc campus, you got the 1908 building, and then it's kind of like piecemealed out over the years. You know, that's still that central hub, but it's expanded with our inpatient units, more residentials. And then as we've grown over the years, we've got more residential buildings across the Oconomowoc campus. But I mean, from humble beginnings, I think in the 40s, our average daily census was around 50 people. Now we're well above, you know, 1,500 at any given time. It's pretty incredible to see where that has grown.
And we will be right back. Real quick, I wanted to take a moment to talk to you about WISE, the Initiative for Stigma Elimination. It unites people across the nation to support those touched by mental illness and addiction. The compassionate approach champions personal stories and powerful connections, fostering healing by reducing stigma through evidence-based practices. Rogers Behavioral Health supports the work of WISE through their Community Learning and Engagement Department. WISE collaborates with a diverse network of organizations and individuals united in the fight against stigma. You can learn more about WISE, explore their 4 key programs, and connect with them by visiting the website www.eliminatestigma.org. And now back to the interview. So, future Rogers, what are some of the strategic goals looking forward?
Yeah, I think the future Rogers becomes really neat, especially, how we're positioned and how we deliver the care in the market. One thing that we have seen throughout COVID and, past the pandemic is consumer preference. I think unfortunately behavioral health care was not the most consumer friendly system to interact with pre-pandemic. It still is difficult in many aspects today to be able to do so. But, we're leaning into what do our patients need? How do they access care in different ways? One way to highlight that is our partnership with Limbic. So Limbic is an artificial intelligence powered chatbot that has a lot of research behind it. And it acts as an additional access point for our patients who may not be comfortable calling on the phone or doing an in-person, assessment. What we have found is we've been able to access different individuals who fit right into that category, that they would not be likely to call on the phone. And I think it's a great illustration of leveraging technology to meet people where they're at. So you're going to see us continuing to lean in those different access points of understanding how do people get into the system in ways that are easy for them, very transparent, so they know how they can get care in the best possible way. The other piece I would say is flexibility. So we're also leaning into offering programs at different hours on different days, some different models that have historically not been in the past. Everybody is very busy and flexibility becomes really key of it. So finding ways that we can meet people of where they're at through our treatment programs becomes an excellent way to be able to do so. And then from the geographic side, we're leaning into providing care in places that we may have not been able to access before. Frankly, Rogers, in a lot of cases, have been a southeastern Wisconsin-centric organization. Despite us expanding to multiple states, we know that behavioral health knows no bounds, right? We have behavioral health issues across the entire state and the entire country. So, part of us with opening up our location in Chippewa Falls too, is meeting the needs of communities where they have behavioral health deserts out there. So that's been a fun way of being able to do so. And then I would also say technology and virtual care is only going to expand. So throughout the years, we've been able to expand our virtual care platform, access patients who are in rural areas who might not have had access to treatment before, and be able to provide them with that high quality evidence-based care. So I would say those are some of the pieces that we're leaning into right now. There's some other aspects that are a little bit way more forward facing that I think could be an interesting piece that we do.
You mentioned the quality of care, but how do you maintain that quality of care with all of the growth and all of the expansion that Rogers has seen in the last decade?
So excellent question, Andy. I think that's one of the things that Rogers has done very well over the years. So, man, this is going on 10 years ago. We really invested into data and analytics. So it is very difficult to measure in behavioral health. There's a lot of very smart people out there trying to figure out what are the right measurements and how do we quantify if someone is getting better or not. We've, in many aspects, really tried to lead the field with it by utilizing systematic measurement of things called patient-reported outcome measures. Patient-reported outcome measures are depression inventories or an anxiety inventories. If you go to your primary care doc, they might ask you a couple questions of, are you feeling sad? Are you feeling down? Those are patient-reported outcome measures. Every patient that comes into our system gets a battery of those assessments at admission, throughout treatment, and discharge. What that allows our clinicians to do is have insight into their depressive symptomology, insight into their anxiety or OCD symptomology, so that they can make different adjustments on their treatment plans. It gives better care, and it allows them to have the conversations with our patients to say, hey, where are you at? seems like a very logical thing to do, like doing some sort of measurement. The latest studies actually show that only 11% of providers in the United States utilize some form of measurement-based care or that systematic measurement of patient-reported outcome measures. But why I say that, that becomes the baseline of understanding how quality is delivered at any of our locations. So we've got the ability in basically near real time to zoom into any of our locations, understand how patient outcomes are, and then model out if locations are doing better, if locations are not as better as other ones, what are the factors and the reasons why, and constantly implementing process to ensure that they're at the quality and the standard. So, where other organizations might wait months or quarters to understand where their quality is, we're extremely proactive because we have that in a very visual, easy to interpret way that our clinical leaders are able to see at any given time. Then when you think that we have close to 25,000 patients every year that come into Rogers and the data collection that comes with that, then we have the ability to really start integrating that data to some more forward-thinking pieces, algorithmically or some different factors of how are we making care even better.
This is a lot of talk about technology.
Yeah. Yeah, there's a lot of tech. We when you look at it, Rogers, we implement a lot of technology into our care. And, I think everybody gets freaked out about AI. So, that AI is going to replace clinicians or whatnot.
I was going to say, you said something about you can chat with the AI bot, but you can still call, right?
Oh, absolutely. You can absolutely call it. The AI access point is only an additional access point into it if you choose to utilize it. But, I think artificial intelligence is becoming a really interesting thing in the behavioral health field. And, we've taken the approach in the stance at Rogers, AI will never replace a clinician. AI will never really do treatment at Rogers, but can AI be a wonderful tool to augment different processes and augment our clinicians so they have sharper ways of understanding where someone might need a little bit more treatment. We always have humans in the loop when we use these different algorithms, but they are ways of surfacing data and surfacing patterns that we might not be able to do so. So a great example, those patient-reported outcome measures, those packets of assessments are typically around 2,000 questions. There is no human in the world that would be able to understand a pattern within 2,000 different questions and in a short period of time.
Sure, yeah.
But when you layer on different statistical techniques and artificial intelligence, it could surface those patterns based on what past patients' treatments look like. So we could utilize that to get you quicker, better, stronger, faster. And I think that's the ethos of everything that we're doing with that.
And we will be right back. Everyone deserves a chance for recovery. That's what drives Rogers Behavioral Health Foundation. They're helping people get the mental health care they need, from covering treatment costs for those in need, to building clinics where care is hard to find, to funding cutting-edge research. They're making real change happen. And guess what? You can help. Head to rogersbhfoundation.org and be part of creating a future where mental health and wellness thrive. And now back to the interview. We've talked about the rising demand for mental health services. Where do you see Rogers going next? Oh gosh, should I put a year on it? 20 years. Next 20 years.
Oh,
Brian.
Man, 20 years?
Okay, 10. Andy, I don't know.
Man, I don't have a crystal ball. I'm not a magician in that way. But if I was going to take an educated guess, I think what you will continue to see Rogers do is continue to build and be in locations that meet needs of the community of where they're at. I mean, I think our mission, being a non-for-profit, is how do we ensure that people have, access to high quality behavioral health care and have them live their full potential. So we will continue to grow in ways that meet the community needs and meet the community demands. Now, a little bit more of the future facing things, I continue to see Rogers integrating data and analytics into their care. Behavioral health is ripe to be able to have data and analytics help understand what are the best interventions for individuals. Do I picture a day where on day one, we have the ability to say, here is a very good treatment plan. Here are all the different interventions that are going to statistically and probabilistically get you to the best possible case at the end of the stay. Yeah, absolutely. Does that take a lot of data collection and a lot of knowledge and generating knowledge in the right way through the scientific method and publishing? Yeah, it does. But I think Rogers is well poised to be able to do that. What has gone on in the research center is absolutely incredible. That group is publishing close to 40 peer-reviewed papers a year. And that information is not only influencing the field, but influencing ways that we treat. Is just an unbelievable thing. And I think the more that we continue to integrate those insights into our care, that becomes the model that we want to do. And I think the beauty of it is it actually integrates Dr. Rogers' legacy beautifully. I mean, when you look at those notes, I do not ascribe to a particular school, but what is proven and what the evidence shows, that's what we're going to continue to do. And we're going to augment it with technology, we're going to augment it with quality, and we're going to augment it with what is going to be best possible for the patient.
I often hear people refer to Rogers as a leader in the healthcare community. What you're talking about sounds exactly like that.
Yeah, you're exactly right. And I think when you define leader in the healthcare community, it's someone who is there for the community, someone who has the quality to provide good outcomes, and it's someone who continues to innovate and grow the field. And I think that's where Rogers is, and that's where we want to continue to be. I mean, we want to be a trusted partner to other healthcare organizations, individuals in our community, and our partners that we have. And, you know, doing the things we are doing, we want to continue to do that.
Brian, thank you so much for joining me today. I really appreciate it.
Well, thank you for having me. I mean, it's really fun to talk a little bit about the history and how we're continuing to honor that history of where we're going forward. So thank you for having me on.
Well, listener, I hope you enjoyed this short journey through the history of Rogers Behavioral Health, from its founding over 100 years ago to the continued leadership role that Rogers takes today. The story of Rogers is one of resilience and innovation, with an unwavering commitment to helping individuals find hope and healing. Of course, Rogers wouldn't be where it is today without the visionary leaders of the past, the compassionate caregivers of today, and a community that really believes in the power of evidence-based treatment. And as you heard, Rogers is looking ahead to the future, one that promises expanded access, cutting-edge research, and of course, a continued focus on individualized care. So thank you again for listening to Rise Above, a podcast from Rogers Behavioral Health. Be sure to like and subscribe to be notified of new episodes. And as always, if you or someone you care about is struggling with a mental health or substance use disorder, visit rogersbh.org for a free mental health screening. Until next time, take care.